high-risk patients with stable angina and type 2 diabetes. Over 2,000 were randomized. There is no advantage to prompt revascularization over medical therapy for coronary artery disease in this setting. So he's just naming a bunch of studies here that are showing that the regular old drugs and call me in 2 weeks, or, Mediterranean diet, basic change advice that you would get from a doctor, call me in 2 weeks, that works better than any of the invasive therapies, angioplasty, stents, or bypass graft surgery. The MASS-2 trial randomized 611 patients with multi-vessel coronary artery disease and stable angina with preserved heart muscle function. At 1 year, there was no difference in cardiac death or acute myocardial infarction between patients in any of the groups, regular therapy or an invasive therapy. No difference. No difference in outcome. If anything, the people with the stents fared worse in some studies. So, he says, there you have it. The leading state science judges in the audience were dumbfounded. He's talking about a tribunal that he was a part of. It was actually a mock trial to a bunch of judges. The Chief Justice of the host state and several other justices were dumbfounded. The judge who was role-playing the defense attorney for Dr. Clayton's malpractice insurance company was silenced. The judge who was role-playing as the plaintiff's attorney on behalf of Mrs. Jones smiled. The assembled judges were asked to vote on whether, according to the Daubert standard, which is it's what this mock trial was about. It's about this Daubert standard. And the Daubert standard is a rule of evidence regarding the admissibility of expert witness testimony. So a panel would decide based on the Daubert standard whether to allow a witness to testify. It's not necessarily supposed to be about medical efficacy, but this mock trial exercise is teaching judges how to understand medical evidence, basically. They're the ones that ultimately have to rule whether something is admissible or not. So according to the Daubert standard, my testimony should be allowed before the jury. They voted overwhelmingly in the affirmative. So why is it that over 1 million such invasive procedures are performed in the United States each year and indemnified by all private insurers, by Medicaid programs, and by Medicare? If angioplasty was a pharmaceutical, do you think the FDA could find a way to license it when the critical data prerequisite to licensing it was a series of negative randomized controlled trials? But procedures are not subjected to licensing. Hey, did you hear that? Procedures are not subjected to licensing. Drugs are, procedures are not. And devices such as stents are held to a much lower standard. They must be safe in the short term, but there need not be a demonstration of efficacy. But the drug-eluting stents led to more harm in some studies. Shouldn't the FDA remove them from the market? The FDA convened an advisory committee on which stakeholders were well represented, and came to the conclusion that prescribing clopidogrel for these stented patients was safety enough. So they give them this drug to minimize some of the problems with stenting, some of the early problems that show up. Hence, the FDA is not standing between Americans and the invasive cardiology and cardiovascular surgery community. Since the coronary artery plaque removal enterprise is the recipient of a sizable portion of the healthcare dollar, it has the fiscal wherewithal to make certain that it is favored in the media, in Congress, and generally in the mind of the public. A few of the leading medical journalists, such as John Kerry in Business Week, have had the editorial support to display the relevant science as early as 2005, but such efforts are overwhelmed by the miasma of marketing. Miasma means like bad air, or like deadly fog. It's what they thought caused the plague. So he goes on a lot about this, but he's